it's devastating, actually, the way that we treat women in such an archaic and so far behind we are in research and development and innovation for women in women's health.
Yeah, because Chris, the one thing that we hear time and time again is, and so unfortunate, they're like, I went to my doctor about my acne, about my moods, about my energy, about my anxiety. And they said, oh, it's just part of being a woman. It's part of being a mom. It's part of getting older. Here's the birth control pill. See you later.
That is like, again, horrible. This is like, birth control should be for birth control, but doctors will hand it out like it's candy or for any kind of women's issue. Oh, you have heavy bleeding or you have acne or you're a 15-year-old who want to regulate your period. Here's the pill. And this is pretty devastating because I don't think a lot of women understand how the pill even works or hormonal birth control. It's actually not hormones. What they are synthetic fake hormones that bind to receptors and stop the production of your own hormones. So they essentially, that's how they make you infertile, is they lower your estrogen and progesterone to nothing. And so, women, we're meant to have fluctuations. And so it stops these. And so in a way, you're treating some of the symptoms. But what I find that most women have, like 90% of women don't like birth control. They have side effects. They get bloated, they gain weight, they get headaches, they get depression, suicidal, and they get acne, which is like weird because they're giving it for the acne. But I think in general, most of the time it causes acne. And that's because you're eliminating progesterone and estrogen, and which protect the skin. They keep it resilient and, all the things we're going to talk about. But so that's the problem with birth control for women. It's like, we don't have any other solution. That's pretty sad.
It's an end all be all. They're like, oh, it fixes everything. If you're a woman, you just take it like a supplement every single day. It's like your vitamin D. But I think what's so important is, especially with like the millennial generation and older, is we were never told the effects that the birth control pill can and will have on your body. Like I remember going in at the age of 14, didn't need it, decided, oh, my girlfriends are taking it, I should probably take it. And my doctor's like, yep, here's 6 boxes. See you later. I'll see you in 6 months. That was the end of the conversation.
We're not being fully informed. Even the risks are low, but they're still there, but they're not being informed. And we don't really, doctors will claim that it doesn't impact fertility later in life, but I don't think that this has been studied well enough for us to even make that claim. And women, I talk to them all the time. I was on birth control for 10 years and then I couldn't ever get pregnant. Or, now I'm suffering from endometriosis or PCOS or other or early post perimenopause. How do we know that the birth control pill doesn't cause this problem that we're seeing low levels of hormones earlier and earlier, like women in their 20s have levels of like a 90-year-old now, because is this the impact that we're seeing now from decades use of birth control in the population? We're probably not liberating them, but in fact, we're probably making them more unhealthy. And if the birth control is meant for like a short-term use, yes, we should have control over these decisions, but it shouldn't be meant for a treatment. Like birth control is not a treatment for endometriosis. It's not a treatment for PCOS. It's not a treatment for acne. It's like, it's not a treatment. It's meant to be a birth control. It's supposed to make you infertile for a short period of time so you don't get pregnant.
And I would say the vast majority of our clients do not see the skin wins that they were promised when they were like, here, take this. This is going to improve it, because obviously you need to be on the birth control. That's what takes care of your skin.
I'm really glad to hear you say that. And that doesn't surprise me at all. Like you're literally taking away estrogen, progesterone. And we know how important this are for collagen, elastin, hyaluronic acid, sebum production, maintenance of like resilience, reducing inflammation in the skin. Like all of the skin is needed. Like you need estrogen and progesterone for it. So when you take it away, and when they go off of birth control, later these women, they're not recovering their hormones. So we see that like it takes them a while, or they don't get their hormone levels back. And this is also what's devastating. So these probably see their skin because they don't have the estrogen, progesterone available.
And I'm so curious, Dr. Sarah, is obviously being a trained medical doctor, you went through that Western medical training and education and years in that system. For you, was there a turning point where you started to realize that these medications like the birth control were impacting the health of your patients, or was this something you kind of known the whole time?
No, it's interesting. Like there's zero training in medical school. And I know this is coming out now, that there are a lot more people talking about this. Zero like hours about women and their hormones in medical school. So we're like kind of told that, and I think that even most doctors think that birth control is hormones, and so women like associate this. And even when we see women who need treatment in perimenopause and menopause who are suffering greatly, they're afraid to go on hormone replacement therapy because they think it's going to be like birth control, because they've had this experience, and doctors still perpetuate this belief that hormones are the same thing as birth control. And it wasn't until later I'm classically trained in pathology, which is the pathophysiology of disease, like all over the body. So I'm like a doctor's doctor, and did this for a long time. And you really see how we've failed, especially women, and like blocking, pharmaceuticals rely on blocking a process in the body as opposed to providing the environment that is like enriching it so that the body can heal itself. Like you said, the body has the ability, it's fighting for itself. It has the ability to heal if you give it all the things that it needs to heal. And instead of in pharmacy, like, oh, your lipids are high, well, let's just block the production of LDL. Instead of looking at like the bigger picture, we're very symptomatic approach. And this doesn't work. Like it certainly doesn't work for preventative medicine or wellness. It might work for acute care. And we still need doctors that are specialists in acute care. If you get in a car accident, like we need that. Yeah. Like, great.
I want to go to the ER. Please bring me to the ER.
Don't come to me.
There's specialties in certain areas that are really important. But in terms of like prevention and wellness, it's not trained. It's not a part of medical school. So anybody that does anti-aging or hormone therapy or nutrition or functional type of medicine has learned it outside of their traditional training.
And that's why I was so excited to have you on the show, is because you have that Western medical background and you've, been able to weave in that functional medicine component, the anti-aging, working with the body instead of against the body.
Exactly. And you really, the more you use that natural body process that's already existing, you just learn like what that, and the holistic approach, then the body will do it itself. And that's what's so incredible about it.